This is Bwama Health Centre on Bwama Island, one of the 29 islands on Lake Bunyonyi in Kawale District, the second deepest lake in Africa. Like it is a normal practice in most health facilities in Kigezi region, it begins with religious leaders coming to the facility to pray for the sick and invoke God's healing hand upon them. When I reached at the health facility, I found health workers going about their normal routine business of treating patients who flock the healthy center on a daily basis. However, when you are at the facility, it is hard to notice the hurdle health workers and patients go through to reach at this facility to seek medical care. And according to the in charge of the facility round out in Gabirano, every day the health center receives general medical cases like malaria, pneumonia, aerial diseases, respiratory tract diseases, skin diseases, not forgetting conducting deliveries and offering antenatal services. Gabirano says that they conduct between 20 to 30 deliveries every month and around 12 antenatal and postnatal care services every day, and also dispense between 10 to 20 family planning services, among others.
Means which are easy and they can easily access the facility. We usually receive general cases like pneumonias, we get malarias, we get diarrheal diseases, we get respiratory tract diseases, skin conditions, especially for the children and the other. Then we also have services for our mothers delivering, antenatal, family planning, and anyone who comes with a complication of such, especially in pregnant mothers, they are also handled from here. We conduct 25 deliveries in a month. Every day we conduct around 12 to 20 antenatal care cases with postnatal services, and family planning services are also done on a daily basis, and we usually have around more than 10 mothers, 10 to 20 mothers who are coming for family planning.
We are still at the facility. Time is clocking around midday. The in charge of the health facility in Gabirano receives a phone call for an emergency expectant mother from Butanda sub-county across the lake. Immediately, an evacuation team is assembled and gets on board the ambulance boat that was donated by the Ministry of Health with funding from Gavi. This lady, called Sharon, not real name, had started experiencing contractions, and the people at her home were worried how she was going to give birth without any attendance of the medical doctor. However, upon the evacuation, the lady delivered at the facility on time and safely. This is one of the many cases that have been helped with the deployment of the ambulance boat at the health center. Sam Kahima, the coxswain of the ambulance boat, says that ever since they were deployed at the lake, they evacuate between 7 to 10 emergency cases weekly.
Abinja mukutungana babine urubire chini babine bizoki
okusinga cases zabo n'abakazi benda
The health center in charge, Ronald Ngabirano, adds that the boat has eased their work on evacuating emergency cases like expectant mothers, saying that the new 300 power horse engine boat, which moves at a speed of between 45 to 90 kilometers per hour, has helped a lot compared to the 15 power horse engine boat that they used to use on the lake to respond to emergencies. This, he says, has reduced on cases of expectant mothers delivering from traditional birth attendants and some cases of expectant mothers who deliver from boats.
The time when they call us, it takes us around 20 minutes to reach them, and we are able to transport them. Those are the ones who are at the farthest side. Then the ones who are near, even it can take 10 minutes to reach them. It's completely free because it was given to us by the government. It is being fueled by the government, so there is no need of charging money because the service is completely free of charge. Our numbers, the in charge, the ones responsible for the boat, and midwives and nurses, the numbers are with our clients everywhere. It is a matter of giving us a call and are able to come to the rescue.
The Kawale District Communications Officer Alex Biakatonda says that the boat has been a sigh of relief to many people, especially those living around the lake, since it has eased transport for all the patients that would want to seek medical attention at Bwama Health Centre III. He, however, says that the area needs about 5 boats to help evacuate and cover all the sub-counties that this health center serves. And also to help in facilitating the vaccination exercise around Lake Bunyonyi. And apparently it is being maintained by the Ministry of Health with collaboration from the Ministry of Defense and Veteran Affairs. And the Ministry of Defense and Veteran Affairs have provided coxswains, the people who are driving this boat, for the next 2 years. After that, it will hand over to the Ministry of Health entirely to manage the boat. If you look at the population of the people that this health center serves, this boat is not enough. We would need like 5 if we are to cover all the 7 sub-counties that this health center serves.